Hello, my name is Addison Leigh, and I decided to discuss carpal tunnel syndrome for the Conditions and Disease Project. Beginning with a general overview of what carpal tunnel syndrome is, I found this definition on the Merriam-Webster Dictionary. Carpal tunnel syndrome is a condition caused by compression of a nerve where it passes through the wrist into the hand and characterized especially by weakness, pain, and disturbances of sensation in the hands and fingers. To break down carpal tunnel and to help you gain a better understanding of what this term means, carpal means wrist, tunnel means passageway, and syndrome means group of symptoms. As far as the history of carpal tunnel syndrome was first described by James Jackson Putnam in the year of 1880, as well as contribute from with the help of contributions from other notable physicians. And it is the most common type of peripheral nerve compression and often caused by unknown factors, typically involving inflammation that compresses the median nerve, as we said previously. Um, Common symptoms also can include nighttime tingling or burning pain, and weakness in muscle and muscle loss in the thumb area. This was all found by James Jackson Putnam and his colleagues when discovering and researching what carpal tunnel syndrome was. Carpal tunnel syndrome specifically affects the wrist and the hand, and the pain that a person feels in their hand, as well as the mobility. And it is due to the compression of the median nerve. This condition affects the body through nerve compression, which creates pain and numbness and tingling, and possibly even weakness. There are three forms of carpal tunnel, the three being mild, moderate, and severe. Mild are when the symptoms are occasional, and it's not really inflicting any pain on the patient, and it's very minimal, and it's not affecting their daily life. Moderate is a step above where the patient begins to experience tingling or numbness or more symptoms in both the night and daytime. And severe are when symptoms are constant and severe and can even include a loss of sensation and are really beginning to affect that person's daily activities and could possibly even be in need of surgery to solve the problem. Carpal tunnel syndrome is strictly something that is due to physical and anatomical factors. It can be caused by repetitive hand movements, such as typing in the photo beside this. Inflammation and swelling can also be factors and causes, and previous wrist injuries can also be a cause, and things such as pregnancy or arthritis can also lead to carpal tunnel syndrome. The incident slide includes several facts regarding carpal tunnel syndrome. Hopefully, this can help you gain a better understanding of what it is, who it affects, and things of that nature. The first question is, how many people does this disease affect? This condition affects 3 to 6% of adults. And I also found this quote to be very interesting. Carpal tunnel syndrome affects up to 10 million people in the United States, so it is a very common occurrence in the United States. That even led me to wonder if it's due to the increase in the technological era, such as typing and things of that nature, if that is increasing our overall numbers of carpal tunnel. Just a thought. But the second question is, does it affect a certain age group? Do From my research, I found that it affected mostly middle-aged adults, ranging from 30 to 60 years old. And as far as an ethnic group, carpal tunnel does not specifically target um, a specific ethnic group, but it does show that people of color are less likely to receive care for it just due to the disadvantages in healthcare, and that Caucasians may be at higher risk due to socioeconomic factors. Um, so therefore, Caucasians are more likely to receive treatment than people of color. And as far as the mortality rate, while carpal tunnel is extremely painful for some people and quite inconvenient, it is not fatal. Signs and symptoms of carpal tunnel, as we've kind of discussed before, can include numbness or tingling in the fingers or hand, overall hand weakness, and the inability to grip things, which could result in dropping objects or just not being able to simply grip a pencil or things of that nature. And it also excuse me, and signs of carpal tunnel could also be extreme pain in the wrist or hand. And it could also include symptoms being worse at night. And due to that median nerve compression, it does tend to affect the palmar side of the thumb and the index finger and middle fingers and the radial half of the ring finger. But it can also involve the entire hand, so that is something to look into as far as the symptoms and signs of carpal tunnel. When it comes to diagnosing carpal tunnel syndrome, there are a few people that in healthcare that can diagnose this condition. Um, those healthcare professionals include a physician, an occupational therapist, and a neurologist. Different tests that a healthcare professional might run to determine if a person has carpal tunnel can include a physical exam, which is exactly what it sounds like, a very hands-on check of the body to assess strength and movement and things of that nature. A nerve conduction study, which is a test that measures how fast electrical signals travel through a nerve. Tennille sign involves tapping the wrist to see if there is a tingling sensation in the fingers to see if there's any nerve stimulation. And then Fallon's test is holding the wrist bent together to check for numbness or tingling. There are several options of treatment when it comes to carpal tunnel. As you will see as I read, typically surgery is the last the last solution that people tend to go to because it is quite invasive. But some other options include wrist splints, which hold the wrist together while you sleep, that could possibly relieve some pain or any numbness that a person might feel that's struggling with carpal tunnel. Some other things that can be used are anti-inflammatory medications such as ibuprofen, Motrin, things of that nature, just to help the patient be relieved of any pain. Excuse me. Physical and occupational therapy can also help to not necessarily cure carpal tunnel, but to help manage the pain that comes with it. And injections from healthcare professionals can also help with carpal tunnel. It is a temporary solution to relieve pain, but it is an option. And as I said, surgery is the last course of action. There are several different types of surgery that can be used. Endoscopic surgery is one of them, which uses a small camera. Open surgery, which the surgeon makes a cut into the palm directly to relieve pressure from the nerve, and then ultrasound guided is used by a surgeon when the surgeon uses an ultrasound to see inside the wrist when conducting the surgery. Ways to prevent carpal tunnel could include proper ergonomics, which include things such as what I have shown in the photos here, like proper posture of both the upper body and specifically the wrist. Taking break from repetitive tasks can also be beneficial. And just overall wrist positioning in stationary situations and also stretching could help prevent carpal tunnel. A few additional facts that I found to be interesting when researching about carpal tunnel included that it is very common in office workers, as well as athletes or manual laborers who do repeat repetitive tasks daily, and that early treatment can prevent permanent damage, which is very important for especially for people in the fields that I just discussed. And that occupational therapy plays a key role in the rehab of carpal tunnel syndrome surgery. Here are my resources and my works cited page for this project. Thank you so much for listening. Have a great day.